Many medical emergencies require rapid treatments. One example is stroke patients. In the United States, someone has a stroke every 40 seconds, and someone dies as a result of a stroke every 4 minutes. Strokes are the number 5 killer in the United States and a leading cause of long-term disability. For stroke patients, time is brain. Every minute a stroke is left untreated, the patient loses about 1.9 million neurons and 14 billion synapses. In other words, a lot of vital brain function. Luckily, there has been new advancements in treatment that can stop the damage, but getting treatment as soon as possible is the only way to prevent more harm to the brain. Unfortunately, in most hospitals, even ones equipped with electronic medical records, coordinated care is not the priority. Patients, even if they come in by ambulance, must go through multiple uncoordinated steps before receiving potentially life-saving treatments. They are first evaluated by an emergency room physician and then a specialist. Multiple tests are ordered before a life-saving treatment is rendered. All these steps happen in a more or less sequential and somewhat haphazard manner. I designed Neuro to coordinate stroke treatment because every second counts. Coordination can start in the ambulance before the patient even arrives at the hospital. With a simple push of a button by first responders, the app will notify the stroke team, including emergency department physicians and neurospecialists, all at once so they can be ready when the patient arrives. The blood draw team and scanner technicians will also be alerted so they can prepare for the arrival of the patient and move them to the top of the list, potentially ahead of other less urgent patients. Pharmacy will be alerted to have the necessary medications ready to be delivered. In addition, each step will be time-stamped and tracked, and each completed task will be recorded, so all of the information is easily accessible and located in one place. Everyone will know exactly what has been done, when, and what still needs to happen. The current red ocean market for U.S. hospitals is full of cumbersome systems that cause delays for patients seeking treatments. As indicated in the grid, Neuro will eliminate time-wasting reduplications of information and accidental clerical errors or absences. No one will be running around trying to figure out where the process has been held up. It will reduce the time for treatment and the complexity of data analysis. It will raise the standards of care, and it will create a centralized database for easy record keeping and analysis, create a new, easier way to communicate throughout the healthcare system. The strategy canvas clearly shows a significant advantage in adopting the Neuro system. Nowadays, hospitals are required to reach a minimum benchmark in order to obtain the certifications and then annual recertifications before an ambulance can bring a stroke patient in. These benchmarks often include data such as how fast the patients are seen by a physician, the time it takes to obtain a necessary imaging study, and how long it takes for the patients to receive life-saving medications. Currently, obtaining this data is extremely cumbersome and time-consuming. Even using digital files, most departments are not synced, forcing someone to go through the data manually. Because Neuro timestamps every task and stores it in a centralized location, the data can be easily retrieved and analyzed. The current market for the app is hospitals that are stroke certified or want to become stroke certified here in the United States. My first-tier customers would be hospitals that would like to use an optional upgraded product to get help with their time-to-care analysis for certification. For those who would like an additional consultation service, can also be added to pinpoint the gaps in the stroke treatment workflow. The second tier would be the market outside the United States, and the third tier would be hospitals for whom the app could be expanded outside of stroke care to other departments such as heart attack and trauma care. There are about 6,000 hospitals in the United States and 10,000 hospitals outside the US. If our market penetration is 20% and has a conservative growth rate of 20% to 35%, the potential market can reach slightly above $100 million within 5 years as indicated. The buyer utility map demonstrates many major advantages of our novel app to correct the current chaotic system and improve the buyer experience. The app will help hospitals treat strokes more efficiently and at a lower cost. Neuro will be very compelling for all hospitals because who wouldn't want to show a higher level of care while simultaneously improving workflow and efficiency? Furthermore, I hope this app can be modified in the future to help coordinate and streamline other types of emergencies such as natural disasters.